the hand mics over there. Can you please raise your hand? There are 3 hand mics that have been given out.
And Rolika will be distributing prizes to the right answers.
Yes, I will. Where are the hand mics? Can you please help with the hand mics because it's an interactive session.
Yeah, so the plan is to do a session and then kind of, yes, like a post. What
And
you have.
otherwise you can volunteer
Rolika.
and be there.
Time is less.
Yes. So you can just keep telling the spotter part because we have less time. So just go on and say the answer. So
The first prize is an iPad.
Yeah, right. Yes. Okay, so can you take a guess as to what the lesion is going to be? So no case presentation over here, and Ruju wants to do something. What do you want to do? Perfect. So you would like to avert or look out for something. Now, what do you say the answer is going to be? It has to be a real quick spotter part. Dr. Anju is holding the mic. She has to answer.
A lymphoma.
Okay, so lymphoma is one of the differentials. Anybody else?
But Rolika, this is a superolateral fornical conjunctiva.
That's correct.
But the fullness is mostly in the medial. And there is the skin also which looks abnormal. Yeah. So that is a superolateral conch.
Right. That's correct.
Patient has 2 things.
So, sorry? So I'm finding this interesting. So there's xanthogranuloma on the table. There is lymphoma on the table. Anybody else?
Dermolipoma.
Sorry, Dr. Honavar does. Okay, Dr. Honavar can also answer dermolipoma. Anything else?
When was the presentation? He looks old.
Yes, so he presented, it's a chronic presentation.
Like as a child?
No. He
as
is
an adult?
As an adult.
Dr. Honavar, dermolipoma cannot be.
Must have not seen it.
So interestingly, I twisted the tail a little bit. So this is a case of cost. So the whole point of putting this case right there is that the presenters have presented very well about dermolipoma presentation, and as Dr. Honavar said, there are 2 components, and Dr. Feroz has very nicely mentioned that there is a conjunctival component and it looks like there is a dermolipoma there. Do not get confused. The answer could be cost, and the only way to know about the answer is histopathology. So there's nothing much that you can do. So go ahead and excise the lesion and you will have an answer. So another spotter right there. Anybody? It's a quick question.
Close
Anyone can take it. Okay, so I can give a larger picture right there.
Cost.
Cost on exome.
So now the panel has got me, so they know that what am I looking for. And my purpose of putting it across is that you must do OCT because that differentiates it from the squamous cell carcinoma. And you proceed with a clear excision, and again, histopathology reveals the answer. The next question Dr. Honavar is not allowed to answer. So what do you think this patient has?
Complex choristoma.
Okay, so this is a complex choristoma. I agree on that. Anything else that you would like to look for? And Ruju cannot answer this question too.
Raise the eyelid.
Raise the eyelid. Okay, anything else that you would like to examine?
Ears.
Okay, what are we looking at for the ears?
Auricular area.
Okay, then what else are we looking at?
Bald patches.
The head, the forehead,
So
face.
this is a little extension, right? So you see a pigmented mark across the face, right? And the bilateral presentation. And then again, the forehead, as Dr. Feroz mentioned, irregular margins over the eyelid, and these lesions are pink to brown. This is a case of nevus sebaceous of Yaddison, and you must look out for preauricular lymph nodes is also the correct answer. You will see that in golden heart syndrome, but over here she had large geographical areas of patches and ball patches of alopecia, and he was not allowed to answer. But yes, and Of course, you should look out for that these can give rise to sebaceous cell carcinoma or even basal cell carcinoma. So be very careful and follow up these patients, preferably excise these lesions as soon as you can. So very easy, quick question. The panel cannot answer. It's a very easy spot on.
Age of the patient for the delegates.
Age of the patient is around 65.
Onset.
This is also a chronic onset. Yes, OSSN with orbital extension. Okay, pardon me for the next picture. I'm just going to skip that part. So this is an elevated nodular ulcerative or flat ulcerative lesion. They can present as orbital invasion, you must look for, and they metastasize to the regional lymph nodes. Now, another one which Dr. Vikas Menon has mentioned. I'm giving a good hint. This is a very easy one.
Onset. Age of the patient.
So I would love to give the age and the onsets, but you know, that's where the trick part comes in.
It's easy for
Okay, so this is a 45-year-old, and the lesion has grown slowly over the years, say for past 6-7 years. Sorry? I cannot hear you. Pigmented SCC, yes, this is exactly why I put it across. Actually, this is a case of malignant melanoma, and Dr. Vikas Menon had actually mentioned it. And yes, the component does look like it is pigmented, it's OSSN, and then there is a pigmented part of it. But again, the answer will come out by histopathology, and you must make sure that you do a keratoepithelectomy over here and proceed with histopathology. A quick spotter over here. Ruju is excited. Go ahead, Ruju. Easy one.
Pyogenic granuloma.
I thought you would say that, so of course, but these are all tricky ones. This is actually a conjunctival papilloma. It's just a small papilloma. If you look very closely, there you will see those loops, and those are the giveaway for a conjunctival papilloma. I'll try. So, okay, so I've been asked to give the age for all. So this is a patient of 35-year-old male, and who presented with this lesion. He doesn't remember since when has it been there, but has slowly grown over the time. Nevus. So why would you say it would be a nevus? Because yes, you see the cystic spaces. Even though there's a feeder vessel right there, you see cystic spaces. And this is a 14-year-old who presented with the lesion which has been similarly growing.
Choroidal melanoma with PAM.
So I do see features of PAM in the inferior part, but I wouldn't say a choroidal melanoma, I would say conjunctival melanoma. Right, and there's a feeder vessel there, there's a corneal component. The child is only 14 years old, but is doing well, and even if they present with systemic involvement, you can give immunotherapy, and it can be taken care of. So mostly dark pigmented flat lesion, elevated feeder vessel, intrinsic vascularity, scleral fixity, corneal involvement. Always look out for that. Another case over here, and my question over here is not what the diagnosis is. This is a patient with a 48-year-old who's presented with this component on the temporal side, has been there for a very long time, and now the patient has developed new lesions in a speckled manner. So what would you like to do? So I think we have flipping fans over here. So absolutely right. We would like to flip the lid, and you would like to look out for what is underneath. And the purpose is that you must look out for different spots of melanoma. So in any case with melanoma, it might have focal spread, right? And we must treat it. And small lesions which are like really tiny foci, they can be taken care of by cryotherapy as well, and they respond very well. So the patient was treated with plaque brachytherapy, excellent response. The tiny spots were taken care of by cryotherapy, all good. I think I would skip this one because I think it has been covered twice and thrice. You want to tell me what the answer is? Okay, fine. So there's no point of that. A trick question over here. So this is a 42-year-old male who's had this lesion for the past, say, 2 years, and it has not grown much. What would you think the answer is? Okay, Dr. Ruju, you were supposed to answer now.
Adult onset capillary hemangioma.
What did you say?
Adult onset capillary hemangioma.
Okay, fine. I give her that one. This is a case with adult onset capillary hemangioma, and they present, you can confused with pyogenic granuloma. A granuloma and an adult onset or acquired capillary hemangioma are not the same. They're not even lobular. They are absolutely different entities which are to be proven by histopathology only. However, this is a pyogenic granuloma. The more elevated, the more pinkish, and of course you can incite a history. This will be, due to a reason, maybe a rubbing of the eyelid, and you will be able to incite that. Another easy one which I'm going to let go. You can give me the answer quickly. Absolutely. So this one, I have just 2 more left. Absolutely right. So that was, you will see widening of eyelid margin, loss of eyelashes, abnormal vascularity, and that was a pagetoid spread. So thank you everyone, and thanks to the panel for educating us with the wonderful cases.
Thank you, Rolika. It was great coming to the end of this instruction course.